There are medications people take every day for sleep, for allergies, for bladder control, and even for anxiety that seem harmless on the surface, but they may be quietly interfering with your brain's ability to think clearly, store memories, and stay sharp as you age. If you're over 60 or you're taking more than one of these medications at a time, your risk for cognitive decline could be significantly higher than you think. In this episode, I'll explain what this class of medications does in the brain, which drugs are most likely to have this effect, who's at the highest risk, and what to ask your doctor if you're taking one of these prescriptions. And most importantly, I'll share a simple, practical step you can take starting today to lower your risk. It's one I discuss often with my patients in my own clinic, and it's something most people never hear about. So let's begin. The group we're talking about includes medications with something called anticholinergic activity. That means they block a neurotransmitter called acetylcholine, a chemical your brain uses to form memories, maintain attention, and support communication between neurons. Acetylcholine is especially important in regions like the hippocampus and the cerebral cortex. These are central to memory and cognition. When acetylcholine signaling is suppressed for long periods of time, particularly in older adults, we see increased risk of confusion, brain fog, and long-term cognitive decline. Which medications are we talking about? You've likely heard of or used some of these. They include diphenhydramine or Benadryl, often used for allergies or sleep, Tylenol PM, Unisom, over-the-counter sleep aids, hydroxyzine, Vistaril or Atarax for anxiety or nausea, oxybutynin, tolterodine, those are Ditropan or Detrol for overactive bladder, scopolamine patches for motion sickness, Bentyl or Levsin, used in irritable bowel syndrome. What's important to understand is that even though some of these medications are used short-term, when taken daily or long-term, the cumulative effect becomes much more significant. What the research shows. The concern here isn't theoretical. A systematic review of over 1.5 million people found that chronic anticholinergic use was associated with increased risk of all-cause dementia, including Alzheimer's. Another meta-analysis found that using these drugs for just 3 months increased dementia risk by an estimated 46%. And a study published in JAMA Neurology used brain imaging and found that chronic anticholinergic use was associated with brain shrinkage, particularly in memory-related areas. This isn't just about grogginess or slower thinking. These drugs can cause measurable structural and metabolic changes in the brain. Who's most at risk? Certain groups are more vulnerable. Adults over 60, people already experiencing mild memory issues, those taking multiple anticholinergic medications at once, individuals with family history of dementia. The risk isn't always obvious, especially when people are taking several low-dose medications. But taken together, they may suppress acetylcholine levels enough to interfere with brain function. Should you stop these medications? Not necessarily, and not on your own. Some of these medications are still useful for short-term situations or for managing severe symptoms. For example, diphenhydramine for a serious allergic reaction is appropriate. What we're concerned about is routine long-term use, especially when there may be safer options available. If you're taking one of these medications regularly, don't stop abruptly. Talk with your physician. Ask if a non-anticholinergic alternative is available. Review your full medication list. Overlap matters, and it does add up. Here are some safer alternatives to ask about. Common substitutes that are often better tolerated. But again, discuss these with your doctor. For sleep, melatonin, magnesium glycinate, or low-dose trazodone. Minimal anticholinergic effect. For allergies, second-generation antihistamines like Claritin, Zyrtec, or Allegra. For bladder control, mirabegron, Mirbitric, which works through a different mechanism. IBS, peppermint oil, probiotics, or targeted medications based on subtype. Sometimes we need these medications, but often we're using them by default, without reevaluating whether there's a safer long-term strategy. The most important step you can take. Here's what I recommend to nearly every patient in this situation. Print a full list of every medication and supplement you take, including over-the-counter items, and review it with your doctor or pharmacist. Ask one question. Do any of these have anticholinergic effects? You'd be surprised how often we uncover multiple overlapping drugs that are interfering with brain chemistry, sometimes needlessly. That review alone can lead to safer substitutions, reduced cognitive risk, and better clarity on why you're taking each medication. Let's recap. Certain medications reduce acetylcholine, a key brain chemical for memory. Long-term use is linked to increased dementia risk and brain changes. These drugs are commonly used for sleep, allergies, bladder control, and anxiety. Older adults and those taking multiple medications are most at risk, and the most important step you can take is a medication review done thoughtfully with your doctor or pharmacist. Your brain health matters, and small, informed changes can go a long way in protecting it. I'm Dr. John Chuback. If you found this helpful, please share it with a family member or a friend, and please subscribe for more practical, evidence-based health information that helps you make confident decisions about your body and your mind. Take care of your brain. It's the most powerful tool you have. See you in the next video.